Maverick Physical Therapy, little episode 7, thoracic spine, type 1, and out of sync and in sync with bilateral upper extremity drivers and a preset lower extremity LXX, RXX, aka kind of a little lunge stance. What we're going to be doing here, like what we did in episode 5 and 6 for our type 2s, is going to be driving in the frontal and the transverse plane, and then in episode 8 going after some tweaks for both the sagittal, plane for both flexion and extension. So again, kind of carrying through and finishing up here kind of what we'd look for during the assessment process, but every assessment and kind of evaluation that we use pertaining to activity is a great treatment tool, and we need to be able to, when it comes to evaluation, assessment, and treatment, for all that stuff to mesh together. There shouldn't be any difference pertaining to how that's seen. And there's obviously different ways that we'll go about implementing and intervening with that, but you get it. Generally speaking, the basic foundation of things. So this is stuff that takes me maybe like 3 to 5 minutes to do, in terms of just rolling through this stuff, a good 5 to 8 or 10 reps on each side for each dimensional in each kind of troupling hybridical combo, and then rolling from there. So type 1 out of sync, left foot forward, right leg back, LXX stance. Side, head is going to be rotating to the left, right arm is going to be rotating to the left about shoulder to chest high. X position for the sagittal plane. Left arm is going to be reaching overhead to the right now. Just overhead to the right. Episode 8 will add the extension element where I'm reaching overhead to the right, but then back and behind me a little bit more too to get some extension. So what I'm doing right here, right arm is rotating left. Left arm is going to side bend, reach overhead to the right. It's our type 1 out of sync. Type 1 in sync right here. Same upper extremity drivers. Left arm is going to reach overhead to the right in that frontal plane. Right arm is going to rotate and swing to the left. I will let the head oftentimes just kind of go with that. If I want to go and get a little more particular with the cervical spine, occiput to C2 or C1 to C2 has a high affinity for the type 1s. The rotation and side bend in opposite direction is not to say that mid-cervical C3 to C7 cannot do that. It's certainly capable of doing that. It just has a preference for, based on the position of the facet joints at 45-degree angles. Although individually based, when we get a little bit lower in that cervical spine, that CT junction, get access to a fair amount of rotation, fair amount of side bend as well, in which those lower vertebrae of the cervical spine take on the biological like shape and or facet joint kind of position of the thoracic spine. So when we're doing these, and let's say I'm just kind of going with a gaze straight forward right here, gaze straight forward, I'm really going after kind of like cervical spine, even though I may be getting a little type 1 in that mid-cervical spine. Really going after the type 1 and C1 to C2 right there. So if I were to switch sides in, clinic-wise, head is going to be rotating to the right. Left arm is going to be rotating shoulder to kind of chest high to the right. Right arm is going to reach overhead and to the left. Again, I'm looking at contribution of motion, where my asymmetries lie, where I'm successful, where I'm not as successful, feeding from there. And let's go in sync. So, boom, and boom, boom, and boom. So those are type 1s, in sync and out of sync with a preset lower extremity driver. Again, in episodes coming, we've got the wall, but we're also going to be going with our different three-dimensional kind of lunges as well, to use the lower extremity as a little bit more of a driver, and to take the slack out a little bit lower in the chain so that we request more motion higher up. and the thoracic spine. So we'll talk about kind of the process of that and patient population specificity in terms of who would be appropriate to kind of take those next steps. So those are type 1, out of sync, in sync, just T-spine, kind of self-mobs, self ways to kind of assess and to kind of treat, eval that. In the clinic, episode 8 coming on up, we're going after including kind of the troupling of the sagittal plane, the extension and the flexion.